One of the things that is associated with hepatitis C is the stigma that the patients have. What if they turned out to be reactive? What will happen? What will the society say? The society will disown them and categorize them as the reactive, or they should stay away from them.
In the national report of the country, it has been mentioned that only 20 to 40% of the population expected to be positive have been tested for this hepatitis C. And in addition to that, out of those who have been tested also, very few had gone into initiation of the treatment. There are efforts by various governments, but the efforts towards testing and treatment was not adequate to reach the goal. So these all made us to decide definitely we need to pitch in this area so that the testing uptake should be increased, which will complement the national program's effort. So we had an initial discussion with the National Viral Hepatitis Control Program. This whole idea was further moved on. Like there was selection of geographies, like primarily this study was done in Uttar Pradesh and Mizoram.
In UP, it turned out that the National Viral Hepatitis Control Program officials were very much enthusiastic about the project and went out of the way to make things easy. For example, contacting their known contacts in other districts. So it made it easy for us to build rapport outside of the centers of Lucknow.
But the prevalence in Mizoram among the general population who are visiting the facility site and also the injecting drug users, who are the two main key population under this study, was very high. So managing something what was envisaged in 6 months, making in 1.5 months was another hurdle. Getting approvals, getting testing, getting drugs, getting participant in the geographical terrain of Mizoram is also very huge and difficult.
As a first step, we selected the geography and then moved on to a selection of the population. In India, we restricted ourselves to people who inject drugs, which is widely and highly affected by this disease. And then we also have a general population, the people who are having thalassemia and frequently going for a blood transfusion, or who are visiting to an HIV testing facilities, including dialysis. So identified as an at-risk general population.
As we started this study, that protocols automatically, like it has to go through a number of regulatory and ethical approvals as well as. So like meanwhile it takes time, and it's a natural process of getting approvals of all the study.
We have taken approvals from PATH ORA and WHO ERC. In addition to that, PATH has taken local IRB approvals from Mizoram Medical College, KGMU and Sanjay Gandhi.
So PATH had a vision for this project, like by end of the project or within at least 1 year by end of the project, we want to have these self-testing kits made to be available in the local market. So there are 2 different kits which has been considered as part of the study. And the key thing which I want to highlight about this kit is about one is a blood-based while the other is a saliva-based kit.
HCV self-testing refers to a self-care approach which allows people to test for the disease on their own and find out the results at a location of their convenience. The blood-based test kit allows one to test for the virus with only a prick of the finger, similar to rapid tests used by healthcare professionals. On the other hand, the oral-based test kit uses oral fluid as a test specimen, providing a non-invasive option.
because data is a backbone of any studies. So we conduct this study in two ways, right? In two phases. First of all, the rapid formative assessment, in which we take the perspective of everybody. They belong to a very poor background, poor education. So that community is already on the marginalized.
OPD टाइमिंग्स में हम लोग ग्रुप में जाते थे, हम लोग बात करते थे। हर एक डिफरेंट डिपार्टमेंट में हम लोग विजिट किए। नेफ्रोलॉजी डिपार्टमेंट है, यूरोलॉजी डिपार्टमेंट में, और सर्जरी के पेशेंट डायलिसिस के होते हैं, गैस्ट्रोएंटरोलॉजी में हम लोग ने वर्क किया। तो इस तरह से डिफरेंट डिपार्टमेंट में जो पेशेंट्स आते थे, गैदरिंग होती थी, उन पेशेंट को जाके मोबिलाइज करते बताते थे कि सर इस तरह का हम लोग का प्रोग्राम चल रहा है, इसमें अब सेल्फ टेस्ट किट आई हुई है जिसके थ्रू आप खुद रिजल्ट जान सकते हैं, जो कि इंस्टेंट रिजल्ट मिल जाएगा, आपको तुरंत रिजल्ट पता चल जाएगा। और उसके बाद में हम लोग ने सेकंड फेज़ हमारा जो रहा इंटरवेंशन फेज़ रहा। इंटरवेंशन फेज़ में हम लोग ने जो हमारी किट्स डिस्ट्रीब्यूशन का वर्क था, किट्स डिमॉन्स्ट्रेशन का देखा कि कितना हम लोग का किट्स यूजेबिलिटी है, कितनी एक्सेबिलिटी है पॉपुलेशन के साथ में। तो इस तरह से हम लोग ने उस पर वर्क किया अपने प्रोग्राम में।
For the virtual model, we had two different, because the language becomes a barrier. Somebody who is not from Mizo will not be able to meet counsel or provide information to the Mizo people. So we had two different numbers and two different counselors.
As a research coordinator, my role is to coordinate with different institutions for this study. We worked with Ebenezer Hospital, Synod Hospital, Sercon Christian Hospital in Lunglei, the Civil Hospital in Lunglei, as well as DM Hospital, MedAim Hospital and Civil Hospital in Champai.
At first, at Champai, we start meeting with private facilities and public health facilities, and we are collaborate with the managers and the medical superintendent, and then they give us a space for the distributing hepatitis C self-testing, and we are putting posters, and the hospital staffs are also helping us in mobilizing the participants.
इस पूरे ओवरऑल स्टडी के लिए कोबो टूल्स का यूज किया गया है। कोबो टूल में पूरी कंप्लीट क्वेश्चनायर होती थी। कोबो टूल को 4 पार्ट में डिवाइड किया गया था, जिसमें पहला था रजिस्ट्रेशन और दूसरा सेक्शन 1, सेक्शन 2 और सेक्शन 3 था। रजिस्ट्रेशन में हम उनकी बेसिक इन्फॉर्मेशन लेते थे कि वो कहाँ से हैं, उनका क्या एज है, क्या ग्रुप है, ये उनका उसमें कवर करते थे, और साथ में सेक्शन 1 में उनके बारे में पूछा जाता था, और पूरी उसकी कंसेंट लेने के बाद, उनका कंप्लीट होने के बाद फिर हम सेक्शन 2 पे जाते थे सेल्फ टेस्ट के लिए। और टेस्ट जो होता था उसमें कोबो टूल में भी हमें ये एंट्री करना पड़ता था कि हम असिस्टेड मोड में जा रहे हैं कि नॉन असिस्टेड मोड में जा रहे हैं।
For the ensure the data quality and completeness and correctness of the data, we coordinated we work with the many stakeholders. During our monitoring visits, we also met hospital administrations, hospital staff for the better implementation in the SCVST data collection.
See, any program will not be succeed unless you will not hand over the program to the community. With the part of the transparency, since the beginning we have make a community advisory board. With this view, with this target, with this goal, that we should be very transparent with the community, because no project can be running so longer. No, any time it is end time is already defined. So that is why to involve the community, to prepare the community is our task.
Atanzu hepatitis C hi antan chuan na hlawom em alo ni ngai lava apia lama testing le treatment po thil poi mo beran ngai ngai lo wang khan engtiang takin nge an mi chana te kan han ngai tha malak na tur te kan han duang chawa khata khanin ani pon min phupui em a.
We have had an excellent staff and full support from PATH and our counterpart Sathi, who are implementing this program among the general community and at-risk population.
HCV प्रोग्राम था, इसके सेल्फ टेस्टिंग के साथ मुझे काम करके बहुत अच्छा लगा, क्योंकि कई लोग ऐसे थे ना फील्ड में कि जो अफोर्ड नहीं कर रहे थे इसका पेमेंट। ऐसे भी कई व्यक्ति आए जिनका हम लोगों ने टेस्टिंग किया, उनका NBSC प्रोग्राम से लिंक कराया, वो 10 दिन की दवा स्टार्ट हुई। उन लोगों को समय रहते अपनी बीमारी के बारे में पता चल गया, और उससे उस बीमारी की दवा कोई दूसरा भी नहीं प्रभावित होता।
So the concept of testing for e-health condition is not new per se, but more and more usage of it in the field of infectious diseases actually could help people to feel empowered in terms of not only knowing the situation or the infection status of themselves, but also to move ahead for the next steps which would be required.
Hard work of our team paid off, due to which awareness about the hepatitis C increased, and people, those who were diagnosed with hepatitis C, they were linked with the treatment program.
Based on our study, self-testing is very easy to use by the study participants. So, self-testing is possible and it is acceptable. And HCV is treatable and curable.
If I have to describe hepatitis C self-testing kit in one word, that would be
collaboration.
Easy to interpret.
For me, SCVST means your safety in your hand.
Self-sufficient.
Incredible.
People-centric approach.
Synergy is something that is really underscores the need to address the problem.